Good afternoon, folks. This is Robert Chappell, Executive Editor at Madison365 with your daily update for Wednesday, May 19th. Hope you're having a good Wednesday. The coronavirus news today continues to be pretty good. It's right in line with where we've been. It's, it's a no news is good news situation, right? Nothing terribly surprising in the numbers today. 383 new cases, which is actually down from yesterday, although testing is also down. We got about 10% of the new first-time results are positive. Yesterday was 12, so it's been between about like 8 to 12 for the past several weeks. So that's fine. The positive test rate overall, which is the key number, the past 7 days, 2.8% of all tests returned positive results over the past 7 days. We want that to be below 3.0, right? There's nothing magic about 3.0, but if you ask public health folks, epidemiologists, they'll tell you that below 3.0 positive test rate indicates that you're doing enough testing and that you have a handle on it and you're able to do the contact tracing on those positive cases. So that's fine. It was 2.7 yesterday, so ticked up 0.1%. As long as it stays below 3.0, I'm fine with that. It was at one point all the way down to 2.0, like in mid-March, but it went all the way up to 3.8. It is now back to 2.8, which is great. So we'll take that. 5 fatalities reported today, and these are not necessarily they didn't happen today. Those are over the past several weeks. We've confirmed 5 fatalities today. Fatalities that occurred in the past several weeks, 5 were confirmed to be caused by COVID-19. Our average of fatalities reported per day, again, this is reported per day, not that have happened per day, is down to 6. And our average for 7 days of new cases is 394. That's the lowest that's been. That hasn't been below 400 in quite a while. So that's great. That's good to see. Most of these numbers are, perfectly fine. Now, keeping in mind that we saw numbers like this last year in June, and we saw what happened in July last year, right? As soon as we hit like July 4th, things started going up and just everything got really critical really fast. I don't anticipate that happening now, primarily because we have a lot of people vaccinated. Last summer and into the fall, it was just very easy for the infection to spread because nobody had any immunity. Even those who had been infected apparently didn't have complete immunity the way a vaccinated person does. Right now, we are at 45.7% of Wisconsin's population has gotten at least one shot, which begins to give you some immunity, right? It's not just that. It's not like you get a shot and there's no immunity, and then you get a second shot and then you're fully immune. It's a process. It's a process inside your body. It's a process with the vaccine. So even that first shot gives you some level of protection. And then that second shot, and then 2 weeks of your body working on that second shot is what gives you the more or less full immunity. Just under 40% of us have had that second shot, 39.8%. So that's good. In here in Dane County, as we mentioned yesterday, the Dane County Public Health, Madison-Dane County, basically said all health orders are going to end on June 2nd. We have heard that the Madison Mallards, starting June 6th, are going to basically go to full capacity. And it sounds like Forward Madison is also, those are 2 of the organizations that I'm really in tune with that draw a big crowd. Sounds like Forward Madison's not going to get the full capacity on June 6th. They're going to be increase the capacity and then probably shortly thereafter get to pretty much full capacity at Bree Stevens Field. What we haven't heard from yet are like concert venues and like Overture Center or the Sylvie or those kind of places. So we will keep an eye on those as they begin to schedule and reconfigure their ticketing and their seating charts and stuff for stuff in the summer. But all that is a roundabout way of saying that the Public Health Madison-Dane County, what they cited when they made that determination was that 63.6% of Dane County residents have one shot. 54% have completed their vaccine. So that's great. Excuse me. The problem is, over in Milwaukee County, only 43% of the population has gotten one shot. Only 37% is fully vaccinated. That's a massive disparity. Yet the city of Milwaukee is also ending all their health orders on June 1st, which I think is, given that level of vaccination, is probably a little bit too soon. So that is basically it on the coronavirus front. Like I said, not a lot of news there, which is good. I mean, I would, at some point here, we're just not going to have a lot of COVID to talk about anymore. It's just, it feels like kind of repetitive, which is good. I mean, that's good. I would love never to talk about it again. So at some point, you're going to tune into my show here, and I'm going to talk to you for 20 minutes about the news and not mention COVID. And you might be a little surprised at first, and then eventually you won't be surprised anymore. And I think COVID is going to become a sort of a part of our lives, but not something we have to talk about every day. Right. All right. So with that, speaking of not talking about COVID, let's move on, and we'll take a short pause. And if you'll stick with us, we have lots of local, state, and national news to talk about on the other side of the break. We'll be right back. Don't scroll away. We'll be back right after this word from our sponsor, EW Health.
Here in the Midwest, community is important.
Having a healthcare system that's looking out for us,
that's actively addressing the racial disparities in healthcare is important.
When we can get good quality care, we can do more. We can achieve more.
We can be the kind of community we want to be, and that's really important.
UW Health. Remarkable medicine. Remarkable care.
All right. So in the news today, you will, if you're a Madison, or even if you're not, you might be familiar with One City School. One City School is a private. It's a public charter school operating on the south side of Madison. It's run by a private nonprofit organization, but it's got a state charter, and it's focused on Black and Brown students. And they've recently gotten their charter expanded to go all the way up to 12th grade. So they're going to have a full elementary, middle school, high school, the whole thing. And they recently, with a massive donation from Pleasant Rowland, bought a building in Monona to house their expanded student body. And of course, this growth requires some assistance. So they've recently hired Judy McNeil to be the senior administrative director. And our Mackenzie Crum spoke with her and has a nice profile on the site today at Madison365.org. Judy, you might remember that One City School came from the predecessor idea was called Madison Preparatory Academy. Madison Prep was supposed to be like an all-black boys' school. It was how it was originally conceived by Kaleem Care. That charter was denied, so it never happened. But Judy wanted to put her kid there. Judy was keeping an eye on that school, and wanted to put her son in that school, and that school never happened. So she's been a business owner, a community leader, and has now, for the first time in 10 years, rejoined the traditional 9-to-5 workforce, rather than being an entrepreneur, to come work at One City Schools and help manage that growth. So that's a good story. It's on Madison365.org right now. In state news, Governor Tony Evers has called the legislature into session next week, Tuesday, to deal with Medicaid expansion, Badger Care expansion. We've got a whole bunch of money from the federal government through the American Rescue Plan the nearly $2 trillion package signed into law by President Biden last month. And about $1 billion coming to Wisconsin specifically for healthcare, Medicaid expansion. That requires legislative action to basically accept that money. So the governor has called the legislature into special session on Tuesday, the 25th. The last couple of times he has done that, they have gavelled in and gavelled out and not dealt with what he wanted them to deal with. So I wouldn't be shocked if they did that again. We'll see. But that is that the Medicare expansion could be happening as early as next week. Excuse me. In national news, sad news today. Paul Mooney, the comedian, actor from you remember him from Bamboozled, Chappell's show, passed away today. At the age, let me get his age for you. Sorry. He died at 79, according to his representatives. And also in national news, the House of Representatives has passed a bill aiming to curtail hate crimes against Asian Americans. You remember we reported last month that the Senate had passed this bill by a 94-1 vote, the one vote against being Josh Hawley from Missouri. This vote in the House of Representatives was pretty overwhelming, 364-62. All 62 no votes were Republicans. The president has voiced his support for this measure and will likely sign it very soon. It's called the COVID-19 Hate Crimes Act. It was introduced by Democratic Representative Grace Meng from New York and Democratic Senator Mazie Hirono, of Hawaii. And it would create a new position in the Justice Department to expedite review of potential COVID-19 related hate crimes against Asian American and Pacific Islander people. We did see, even here in Madison, and we're not immune from this, we saw an increase in hate crimes targeting Asians and Asian Americans after the onset of COVID-19, when some politicians started, blaming it on China and Chinese people. Hate crimes against Asian Americans have always existed, but they're higher now. So the federal government is taking action, and it has now passed both houses of the legislature, and will now go to the president's desk for signature. Thank you, Jennifer. This is the gamble with automatic subtitles and transcriptions. Yes, they were not gambled in and out; they were gavelled in and out. Thank you, Jennifer, for being right on top of that. I appreciate it. All right, so that is what I have for you today. It's a short update today, so we can get going. We'll be back tomorrow with the It's Only 10 Minutes podcast in the morning. And I'll be back tomorrow at 4 o'clock or between 4 and 4:30 with the actually tomorrow it'll be later. It'll be about 4:30 tomorrow because I have other meetings about some other things. A very exciting project that I can't yet announce, that I will announce very soon, and you'll be very excited about it, I hope. Also tomorrow, you will definitely want to tune in tomorrow. We have the new Chief Medical Officer for the State Department of Health Services, Dr. Jasmine Zapata, will be my guest on the show tomorrow. And I will then have that audio then for the podcast on Friday morning. So whether you tune in tomorrow night or catch the podcast Friday morning, that's going to be a really terrific conversation. She is a really fascinating and just a really magnetic personality and a really important person in the state, to be honest with you. So that'll be, I'm really looking forward to that conversation. And and if you have any thoughts, any questions that you want me to ask, drop them in the comments here and I'll get those before I talk to her tomorrow afternoon. Thanks again for being with us. We'll see you soon. Have a wonderful evening.
This is Madison365 Media.